Hello, I'm Kevin Knaus with InsureMeKevin.com. I'm a licensed insurance agent that helps people enroll in Covered California with the subsidies. I get a lot of questions about Medi-Cal enrollment because Covered California also helps determine eligibility for the MAGI Medi-Cal, or Modified Adjusted Gross Income. Now, MAGI Medi-Cal is California's version of the expanded Medicaid program under the Affordable Care Act. It is based solely on your income, not your assets. Medi-Cal is a really big umbrella for many different programs, and many of them do consider both assets and income. But MAGI Medi-Cal only considers your monthly income. And that's what can be slightly confusing about MAGI Medi-Cal, especially when you are applying through Covered California. Because when you look at the Covered California income table, they list annual income and based on the FPL stands for Federal Poverty Level. So at 138% of the federal poverty level, any adult earning that on a monthly amount is eligible for MAGI Medi-Cal. But the Covered California income table shows an annual amount, not a monthly amount. A person could have earned $30,000 for the first half of the year. But when they go to apply for Covered California in July, if they've lost their job and they have zero income, they will be eligible for MAGI Medi-Cal, because MAGI Medi-Cal focuses on your monthly income, not your annual income per se. So that can be a little bit tricky. You'll also notice that there are several different columns of the FPL, Federal Poverty Level, for different situations of household members. So for instance, the adults 19 years and older are eligible for Medi-Cal if their income is 138% or below of the federal poverty level. But the dependent children, that is 266%. So you could have a situation where the adults in the household are receiving subsidies through Covered California, but the children are on Medi-Cal, MAGI Medi-Cal. And then you'll also see columns there for pregnant women and the Medi-Cal access for pregnant women as well. And then there's a county children's health initiative program, and that is for certain counties up in the Bay Area. So that's all a little bit confusing, and people often ask, well, what is the monthly that they're looking for, that Covered California is looking for? So Medi-Cal publishes the monthly FPLs columns. There's all kinds of different FPL percentages. This one happens to show the 138% for adults. So a single adult making $1,468 per month would be eligible for MAGI Medi-Cal. You make over that, then you're eligible for the Covered California subsidies. Now, the children, if you had a household of 3, up to $4,815, which is 266% of the federal poverty level, any children 18 years old and younger would be MAGI Medi-Cal. You would have to make more than that to have both the adults and the children in a Covered California health plan with the subsidies. Now, when you go through the Covered California online application and you enter in your income data, it will show you a calculated monthly income and an annual income. Covered California, for the purposes of Medi-Cal, MAGI Medi-Cal is looking at that monthly income number, not the annual number. So if that monthly income number, regardless of how much you've earned before or you think you will earn in the future, if that monthly income number is within the range of MAGI Medi-Cal for the household size, then Covered California sends that information over to the State Department of Health Care Services and to the county Medi-Cal office, because your income shows that you are eligible for MAGI Medi-Cal. And once that's done, within a very short period of time, you can't change anything. Once you have been determined, you or your children have been determined eligible for MAGI Medi-Cal, you must work with the county. Nothing you do to your Covered California account will have any effect on it. Even if you, the adults, are receiving a subsidy through Covered California, but your children are in a MAGI Medi-Cal program, all the changes must go through the county office. And the changes could be obviously income, but it could be moving, a new baby, all that needs to be reported. And it's very interesting and somewhat complicated and confusing, but all Medi-Cal changes need to be reported within 10 days. Covered California, they request 30 days. And I know a lot of people don't hit that 10-day mark, but do the best job you can. There are various ways of reporting this to your county office. Each county has a different portal where you can upload documents. If you get an increase in your wages, you can fill out a report of change of income form and submit it to them, because they need to verify all of that. They just won't take your word. They need to see a check stub, or if you move, they need to see a new address and documents. Now, each county in California administers their own Medi-Cal eligibility and enrollment. And so that's another kind of confusing aspect. And the health plans are specific to each county. That's why it's important to let them know if you move, because the health plan you had in one county may not be available in another county. The Department of Healthcare Services website has a page where you can look at all the different plans that are available in the different counties. Now, some counties, like Sacramento here, may offer 4 different plans. Other counties may only offer 1 plan. Some plans are privately run, like Anthem Blue Cross Partnership Plan. I think HealthNet has a plan, Molina has a plan, but there are also county initiative, and there are also not-for-profit HMO Medi-Cal health plans. So it runs the gamut, and they're all over the place. That's why you need to always report if you move to a different county, because in the new county, the plan you had may not be available. And when you do report an income change and Medi-Cal says, woohoo, you're no longer eligible for Medi-Cal, MAGI Medi-Cal, they will terminate your Medi-Cal coverage, but it won't be retroactive and it won't be immediate. They're going to give you time. Usually when you report a change, the earliest it's going to end is at the end of the month. Let's say if you report a change on the 10th of August, the plan may terminate at the end of August, because they need to send you out a letter, a notice of action, because there's different laws and rules and regulations to all of that, but that will give you enough time. But it'll always end at the end of the month. Now, loss of coverage is a qualifying event to enroll in Covered California. And when they determine you or your dependents are no longer eligible for Medi-Cal, the Medi-Cal county office, the case eligibility worker, will actually go in and modify your Covered California account with the new income figures if you applied through Covered California. And they release what is called the soft pause that allows you to enroll in a health plan. Now, loss of coverage allows you to enroll in a Covered California health plan with the subsidies by the last day of the month. So if your Medi-Cal terminated August 31st, you could technically enroll in a Covered California plan August 31st and have it start September 1. But try not to wait till the last minute. Try to get to it earlier, because Covered California plans are not retroactive. If you wait until September 1st, that Covered California plan will not become effective until October 1st. And so you will have a gap in coverage. And there is no short-term medical plans in California any longer. So that's kind of the big overview of MAGI Medi-Cal in California based solely on your income and not your assets. If you have any questions, you can leave comments down below. You can go to my website and my email address is on there, and you can send me a question and I'll do my very best to help you out because this is a very complicated system. But MAGI Medi-Cal is pretty good health insurance for most people, and it's zero cost. So it's something to take advantage of. Thank you so much. Stay safe.